Hello, welcome to Midwife Dave, that's me. So one of our videos today, this is about breastfeeding, which is a very controversial topic. So I'm going to do a short video, although it's a massive subject. Please do look up online for further information, because I'm not going to go into lots of detail because it's so massive. My main concern with this video is that lots of you, I've noticed, in groups and social media are saying about how little support you got, how disappointed you were that you couldn't do breastfeeding, that it wasn't as easy as you thought. Okay, so I'm going to run through some key elements with regard to breastfeeding. Firstly, it's really important to bear in mind if your baby is premature, if you've had a cesarean section, that could cause you added complications with regard to actually breastfeeding your baby. So please take the advice given to you in the unit and be patient. It may take you a lot longer to get things going, okay? So the advice I'm giving you here is primarily for healthy babies and term babies. Now, you may have breastfed a baby before and it was great, and second baby, it doesn't seem to be working at all. You may never have done this before. Now, this is key to remember. If this is your first baby, you've not done this before, and neither has your baby. If this is your second, third, fourth baby, you may have done it before, but your baby hasn't. Okay, so it's a learning process for both of you. Be patient. Babies are born equipped to deal with this learning process. They are actually born with enough fat to keep them going for 12 to 24 hours to establish the feeding. So if your feeding's not going great in that first 12 to 24 hours, don't panic, stay calm, keep trying, okay? But remember, nothing terrible will happen to your baby. All right. Breastfeeding is generally done on demand, so it's when the baby wakes for it. Having said that, with newborn babies, do not let them go longer than 4 to 6 hours between feeds, and that's if they've had a good 15-minute feed, 15 to 30 minutes. Now, let's go back to the beginning. So your baby's born, okay, and you want to get it breastfeeding. Remember that when your baby's born, now it may have had a normal vaginal delivery, you may have had forceps, you may have had a kiwi, okay? If you've had a kiwi, which is the suction cap, or forceps, your baby may have a little bit of a headache, okay? If you've had a normal vaginal delivery, your baby is going to be a little bit tired maybe because it's hard work for them being born as well. So don't be disappointed if your baby doesn't immediately go on the breast. I know there's lots of literature and lots of books and lots of videos that suggest your baby is born, you put it to your breast and the baby feeds, happy days, and that's how it goes. Sometimes the baby's born and you manage to get it on the breast with a bit of help from your midwife, it feeds, it then goes to sleep and wakes up as if it's never done it before. So key things to remember when you're trying to breastfeed. 1. Be honest about your breast. Make friends with your breast. Take your bra off and see where your nipples actually go when your bra is off. For most of us, our nipples do not remain up here. They are somewhere down here, and when you lay down, they may well go out to the side. So make friends with your boobs, okay? And be honest about where your nipples lie, because one of the biggest mistakes is people hold the baby up too high. It's then holding the entire weight of your boob in its mouth by your nipple. Several things will happen. The boob will start to slip out because the baby can't hold that weight. The baby will then grab on, and that's when you have nipples that look and feel as if they've been through a cheese grater. Okay, none of us want that. Positioning is key. So identify where your breasts go. Now, one of the easiest ways to breastfeed when your baby is first born is to lie down on your side. Now, this may seem a bit weird, but lie down on the side that you want to feed your baby from. That boob will be on the mattress, all right? Your baby will lie in line next to you with its nose lined up against your nipple. And that is because what happens then, as the baby opens its mouth, the nipple drops in. If the nipple is here, as it opens its mouth, it drops further away, okay? The other thing to try and remember is when you're lining up your baby to breastfeed lying on your side, pull your baby really close. Don't be frightened. Remember, your baby's been used to being curled up really tight inside you, so it feels very secure. The other thing is that your baby can't get itself towards the boob. All right, so lie the baby nice and close with the nipple actually touching the baby's nose. And as it opens its mouth, the nipple sort of drops down into the mouth, pull your baby in tighter towards you. Now, it may take a few goes. You'll find your baby will sort of latch on and mouth your nipple and mouth around the area and then not suck. Don't panic. Just keep your baby there for a while, talk to it. Put your hand on the back of its shoulders as you pull it into you, not on the back of the head. Holding the back of the baby's head when you're breastfeeding causes them to pull off. It's a reflex because they know they could suffocate. Okay, so that's one way of doing it. All right, so you've got your baby here, pressed against you, let the baby sort of fiddle around. If the baby does latch on, brilliant, okay? Let baby suck. Now babies suck sort of 1, 2, 3, and then they stop to swallow, and then 1, 2, 3, may vary a little bit, and then they stop to swallow. They don't suck, 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 suck for the whole time, okay? How do you know if your baby's on properly? Well, one, you don't hear this. If you hear that noise, put your little finger in the corner of the baby's mouth, right, and that will cause a release of the seal. Baby will open its mouth and then reposition. The baby should have as much of the dark area of your nipple in its mouth as possible, so it's got a real mouthful. And the baby, when it's finished feeding and your nipple comes out, it shouldn't be a funny shape. Now, when the baby's first latch on, it will make your toes curl. Lots of literature again and social media will say, oh no, it doesn't hurt, it's not uncomfortable. Well, the first time a baby latches onto your boob is quite a surprising feeling. And you'll be amazed at how strong that grab is, and that can make you jolt, okay? And that's normal. Sometimes also you get a little bit of discomfort with the let down. That says your brain is working and telling your boobs to relax and let down and let out all the colostrum or the milk. And that can feel a little uncomfortable at first. After the first couple of minutes, it should settle down and it shouldn't be painful. Okay, if it is, it could indicate that the baby's not in the correct position. So again, little finger in the corner of the mouth, release the seal, take baby away, have a look at how baby's positioned. Now, whether you're feeding your baby lying down or whether you're feeding your baby sat up, okay, look at your baby. Imagine if you have got something to eat and your chin is down like that. Let's say one of those yogurts that you suck, okay, and you're trying to suck. How comfortable? Do that with me. How comfortable is that? It's really not, okay. The same way as if you try and do it like that, that's really not comfortable. And also, if you try to eat with your head twisted like that, you're not going to really enjoy it. So when you look at your baby and you're lining your baby up to breastfeed, make sure that your baby's head is in a neutral position and that it's in a straight line towards your body, okay, if you're sat up. All right, so baby should be in a nice straight line. And again, whatever position you're in, try and aim your nipple to the baby's nose, and as the baby opens its mouth, push baby on, okay? And don't then let go, because baby obviously, you know, will come off, especially if you're sat up. Use as many cushions as you want, get them in all around and underneath you. Remember that your breast is circular, baby can feed in any position. Baby's been used to being upside down. Have a look at breastfeeding positions online. You'll see babies do lots of weird things. It doesn't matter. If they're comfortable and you're comfortable, that's fine. And that's another important thing with breastfeeding. Make sure that you're comfortable first. Very often come across women who are so pleased they've got the baby latched on. They're sat like this. They have no drink, they have no phone, they have no TV remote next to them, and they've got the most almighty cramp across their shoulders with the too frightened to move because they want the baby to feed. Set yourself up. Don't worry if baby's shouting, it's probably a good thing. Baby will wake up a little bit before it feeds, okay? Get yourself comfortable, make sure you're in a good position, make sure you've got all the cushions and pillows that you need if you're feeding sat up, okay? Make sure you've got your phone if you want it, make sure you've got the TV remote control if you're at home. Most importantly, make sure you've got something to eat and drink, because you do sometimes get really hungry and thirsty when you're actually feeding the baby. Now, although babies do feed on demand, the first 2 weeks in particular can be very stressful if you're breastfeeding. It will feel like your baby's on your breast 24/7, and that's okay. That's supply and demand. Your baby has to demand the milk in order for your body to supply it. It's very clever, okay? And what will happen is, as your baby demands more, your breast will make more, okay? And that's designed purposely so that your baby is full. Now, when you're feeding, remember, the first 3 days, it's colostrum. That's that kind of clear, and sometimes it goes from clear to really, really rich yellow colour that you might have leaking through your boobs in pregnancy, okay? Now, this colostrum is nutritionally amazing, and you'll have seen in my other video, the general one about feeding baby, that nutritionally its value is the equivalent of 30 mils of artificial milk, okay? Now, babies don't tend to feel as full on it, but they don't need as much to be satisfied. And this colostrum also contains all the antibodies that they're going to need. Now, as your milk comes in, what happens is very clever. The first sort of 5 minutes of your feed is actually quite a watery milk, and that's to give them a drink. So you don't need to give breastfed babies additional drinks of water, okay? Your body's already doing that. So for 5 minutes, it will have the equivalent of a drink. It's nice and refreshing, and that's the fore milk. After that is the hind milk, and the hind milk contains all the fats and everything they need to fill them up. So if your baby after 5 minutes comes off the breast and is a bit fussy, may need a little bit of winding, may need changing, okay? Once you've done that, put it back on the same breast to make sure it gets all that hind milk. Because if you're constantly doing 5 minutes on this one, 5 minutes on this one, then he's only getting the drink, and so it's not going to be full up. Okay, now as I said, this is a quick guide with a few handy hints, okay, so do look up online the benefits of breastfeeding, because there are hundreds, okay. And if you are struggling with your breastfeeding, do ask for help. Your community midwife is there to help you, and I know sometimes it can seem that they're really busy. Get in touch with all the breastfeeding associations, such as Mars, okay, there's quite a few out there, and also find some other mums that are breastfeeding to get the real lowdown on what it's really like and their struggles as well. And it can be hard work, and prepare yourself for that. But don't put yourself and your baby at risk. If you are really struggling and you're finding that the baby is not feeding, and it doesn't matter what you try, okay, you may have sore nipples, you may want to try nipple shields. Some people are really against it, I don't know why. If you want to breastfeed, breastfeed. If you're going to do it, the only way you can do it is a nipple shield, well then you go for it. That's up to you, all right? Don't be put off by anybody else. If that works, fine, okay? And if you carry on trying and you find that your baby's going for longer periods without eating and your baby's quite tired and lethargic, don't put yourself at risk and don't put your baby at risk of being dehydrated and losing too much weight. Your baby will be weighed on the 5th day when you're at home, and they will monitor that closely. You know, if it doesn't work out for you, it's not the end of the world. You are not a bad person, okay? Now, with regards to that, some people offer top-ups, whether it's breast milk or artificial milk. You know, do whatever you think is best. And some people go in for mixed feeding, and that's fine too. Okay. Some people will tell you that if you give a baby an actual bottle, a top-up, maybe just 5 mils from a teat, that it won't ever suck from your nipple again. That is not true. Some people say you can only cup feed. You don't have to do that, okay? Cup feeding is very tricky. And can be quite difficult to do. What you can do is you can get a pump, okay? If you want to try and feed and you're struggling but you still want your baby to have breast milk, you can get a pump and pump into a bottle, that's fine. And you can hand express. Now to hand express is quite tricky and lots of people don't like it, and I understand why. But your midwives should give you some advice about that. Basically, you've got to make like a C shape on the dark area of your nipple. Okay, and you've just got to push back into your nipple and then squeeze down. Do not squeeze on the end of your nipple, okay, because you will really damage yourself. If you have any severe pain in your breasts and they are hot and red to touch and you start to feel unwell in yourself, do tell your midwife and get in touch with your GP. It is possible. You may just have a blocked milk duct, but there's another condition called mastitis, which is really quite serious and is an infection. All right. Also, check out, if you're breastfeeding, check out what drugs you can take whilst you're breastfeeding, okay, because some you can't because it is transferred through the breast milk. And remember, generally, whatever you eat influences the taste of your breast milk. So you may find, particularly as babies get bigger, that they get indigestion if you've had a great curry the night before or eaten a lot of cauliflower, and you'll tend to see this in your baby. All right. So, remember, breastfeeding. Make sure you are friends with your boobs and you know where your nipples go when you haven't got your bra on. Be honest, you don't have to tell anyone else, that's fine, okay? Make sure you're comfortable before you start your breastfeeding. Make sure you've got everything you need around you and stay nice and relaxed. Baby will feed on demand, don't let it go longer than 4 to 6 hours, and as long as you've got wet nappies, dirty nappies, and your baby is alert and awake, okay, then obviously you're doing really well. Any concerns, ask your healthcare professional, that be us midwives or your doctor, okay, your GP or your paediatrician. So that's breastfeeding. Any questions, please feel free to comment. I look forward to hearing from you.